Good morning, and welcome to our virtual town hall. During this session, we'll answer your questions about the COVID-19 vaccine. I want to note at the outset that we will not be talking about Johns Hopkins policy relative to COVID vaccines. Instead, we'll focus on answering your questions about the vaccine itself. I'm Dr. Lainie Rutkow, a professor in the Johns Hopkins Bloomberg School of Public Health and senior advisor to President Ron Daniels. I serve as one of the team members leading our COVID planning efforts. I'm delighted to be moderating today's session, and I'm joined by my colleague, Dr. Mustapha Saheed. Dr. Saheed is medical director and assistant professor in the Department of Emergency Medicine at the Johns Hopkins Hospital. He oversees the emergency department's clinical operations and has a particular interest in clinical decision support. Dr. Saheed has extensive experience treating COVID patients and talking with them about COVID vaccine. In addition, he himself received the vaccine several months ago. Before Dr. Saheed's opening remarks, I want to mention that this town hall is part of the Johns Hopkins Get the Facts About the Vax campaign. The campaign focuses on how we can all protect ourselves and protect our community during the COVID pandemic. Getting the COVID vaccine is a key way to keep ourselves and our community safe. In our announcement for this session, we ask that you please send us questions beforehand, and we appreciate the many that we've received. We'll be providing answers in real time, so please submit your questions in the box at the bottom of your screen. This town hall is being recorded, and it will be available for asynchronous viewing. I'll now turn to Dr. Saheed for some brief opening remarks.
Thank you so much, Dr. Rutkow, and thank you for the invitation to join in on this really pertinent and important conversation. I've thought long and hard about how to start this conversation about the importance of vaccine, and I think I've decided to really focus on the part of COVID that we all hear about, but I've seen maybe perhaps too often from my vantage point, where I've seen patients presenting with COVID-19 disease in distress, presenting to the emergency department and having catastrophic outcomes. I speak for so many of my colleagues in the House of Medicine, whether you're an emergency department physician, whether you work in an internal physician, whether you work in the ICU, we've seen so much in terms of the catastrophic impact of COVID on patients and their lives, that we understand and very much are excited that we are in a phase where we have a vaccine that seems to be very efficacious in not only preventing the disease, but also preventing those very serious and severe adverse outcomes. We've seen so much disease and pathology plague our local community, our Hopkins community as well, that I'm really excited to talk about people's concerns about the vaccines and discuss kind of in the context of the risk benefit. I'll also add that this, when we take off our white coats, as much as I'm a physician, I'm also a father and a member of the community. I have my own mother that I'm grappling with to encourage and finally encourage her to get the first shot of the vaccine. And I have my friends and family that we're all actively having these conversations about the risk benefit. And I think very appreciative of having the opportunity to give this conversation and my own perspectives on why vaccination is so important for our community, and really a huge step in preventing this terrible outcome of the plague of COVID in our community.
Thanks, Dr. Saheed. I'm now going to turn to the questions that we've received about the COVID vaccine. And for those who are watching this live, I want to encourage you, please continue submitting questions. We are monitoring the Q&A function as we continue today. So Dr. Saheed, first question for you. As we head into spring and summer, what are the best ways that we can limit transmission of SARS-CoV-2, the virus that causes COVID?
That's right. That's a really good question, because I think what we're all very excited about is that people are vaccinated and that we want to really get COVID and put it behind us. And I can tell you right now, working in the hospital, we've seen another spike, and whether there's fourth spike of really a rash of increased risk of transmission of COVID patients presenting to the hospital and of illness associated with COVID. And I'm saying that not to dishearten people, but to let people know that we're not completely out of this yet. And so what does that mean? So that until we have true widespread vaccination rates approaching 70, 80%, when there's this concept of herd immunity, I'll talk about that and explain that a bit further, we still have to do the time tested and proving interventions that have worked, which include wearing a mask consistently, particularly in any public setting, keeping socially distant, minimizing gatherings, and focusing on interactions with those who are in small networks and families, households, so to reduce your risk of exposure. All of those things have been proven to be efficacious in reducing the spread of COVID, and we need to continue to do that until there are very specific instructions that allow mass kind of resumption of our normal way of being. I'm not sure we'll ever immediately get back to pre-2020 world. It'll be a gradual process for all of us, but I think that the constraints will slowly reduce, but now we aren't there yet. We still need to wear masks consistently, reliably, and maintain social distancing.
Thank you. We're getting a lot of questions about variants and the vaccine. So could you speak generally about the COVID vaccines and what we know about how effective they are against the variants that we're learning more about every day?
Yeah, I may even take a step back conceptually to get a better understanding of what we talk about when we mean variants. Like all viruses and all living things, they reproduce, and COVID isn't, through their RNA and DNA in some living things. What happens is that there are mutations that develop over time, and some mutations kind of alter the ability of an infectious disease or a virus or a bacteria to infect, and maybe changes the characteristics a little bit. This speaks to the importance, excuse me, this speaks to the importance of our vigilance in reducing COVID infections, because by reducing COVID infections, we reduce the opportunities for viruses to continue to evolve. The more and more COVID infects a person, makes millions copies, mutates in the person, the more and more chances that we have viruses evolving. So really wearing a mask, maintaining social distancing, and doing all the things you can to reduce the risk of you and or your family of getting COVID is one way to also reduce the risk of us developing worsened and more catastrophic variants, presentation and mutations in COVID. Now, to your questions about whether or not we have efficacy around the vaccine in regards to variants, this is an evolving area. We have good news, which is that many of the variants, at least the preliminary research seems to suggest, the vaccine, particularly Pfizer, Moderna, and the Johnson & Johnson as well, have some efficacy, if not in reducing complete infection, at least the severity of infection. So that there are two kind of categorization of how the vaccines work. Some of the vaccines, when we look at it, have the efficacy in the 90 percentile in reducing moderate to severe infections. But sometimes we really care the most about the severity of the illness, the risk of hospitalization and mortality, which is death associated with the vaccine. And we've seen that the efficacy of the vaccines against COVID-19 in this regard, even with the variants, is still pretty high. Now, more and more data are coming, and we're seeing more and more news about variant evolution. So this is an area of ongoing discussion. What we can really do to help move this along, to shut down this kind of discussion around variants, is really and continuing to maintain social isolation and distancing and mask wearing, and then B, getting the vaccine as soon as possible, which reduces the risk of infectivity. All in all, the less people are infected, the less mutations we have, the less variants that develop.
Thanks, Dr. Saheed. Next question for you. For someone like you who's fully vaccinated, can you still get sick with COVID?
The risks are much, much lower that I can get sick with COVID. I'm not going to risk it by going into a room and having someone with COVID cover my face. Virus burden and exposure and all of that kind of impact that risk, but they are much, much lower. How I still mitigate those risks, I still reduce those risks by wearing a mask and trying to control that. So we in the House of Medicine never say 100% because very rarely is something 100% efficacious. And these vaccines aren't either, but they significantly reduce your risk of getting COVID-19. And that's a marked improvement, right? And the studies that looked at the vaccines in terms of assessing for efficacy, many of the studies assess 50, 40, hundreds of thousands of patients. And of course, now we vaccinated millions of patients. There is a marked reduction in the risk of COVID-19 in those that in the risk of infection with COVID-19 in those who received the virus versus those who didn't.
Thanks. And I have a related question for you, and we're getting a lot of questions with this flavor in them. So once someone is fully vaccinated, what is their risk of transmitting the virus to others? And by others, it could be those who are also fully vaccinated or those who are not yet vaccinated.
Yeah, that is such a complicated question right now in an active area of research. We know that when you get the vaccine, your risk of severe disease with a COVID-19 infection is much lower. It's really, we're talking about 99% to 100% protection against severe disease, which include hospitalization, ventilator time, and even mortality, death associated with a COVID-19 infection. So that's brilliant. What we don't perfectly know are the risk of being an asymptomatic carrier and still spreading it despite the fact that you're vaccinated. Because you can potentially, and there's some data around this, that if you do get infected, maybe you get a mild disease that is pretty benign to you, but there's still a question about whether or not you can still kind of spread the infectivity. That's why we're still asking people, even those who are vaccinated, until we get to the point of massive herd immunity, where lots and lots of people are vaccinated, that people still have to take standard precautions, not so much for yourself per se, because like we just discussed, your personal risk of a bad outcome from a COVID-19 infection once you're vaccinated is low, but there is still a potential that you may transmit the COVID disease. Now, the promising data coming to suggest even the risk of transmission is much, much, much reduced when you've been vaccinated, but more to come on that. It's not a definitive space yet. And the better part of caution right now is to still wear a mask and maintain appropriate precautions, especially when dealing with folks, whether they're family or friends, who are higher risk of developing real complications from COVID-19. And if they've not been vaccinated, you really should maintain appropriate precautions with that population if you're exposed to them.
Got it. Thank you. And can getting the vaccine itself make someone infectious?
The vaccine itself, you're not getting a live vaccine at all, right? So what you're getting is a copy of DNA, which is kind of protected around, and then your body turns that, RNA, your body turns that genetic material into proteins. And these are proteins that are found on the real live virus. And your body, once your body's immune systems, the fighter cells in your body, sees these proteins in the bloodstream, they learn to figure out how to attack it. They produce antibodies, and your innate immune system really revs up and gets smart about fighting the virus. That's what the vaccine does. And it's a similar technology to all vaccine insofar as we prime your immune system by exposing them to a subcomponent of the real infection. In this case, the subcomponent that we're priming it with is not a real virus. So the chances of getting COVID-19 from a vaccine is zero, because you're not getting a live virus. You're getting a part of the genetic material of COVID-19 that codes for a protein on the virus that is particularly useful and part of the immune response to the virus. So if that makes sense. So you're not getting live virus. The chances of getting COVID from this a vaccine is zero. You're just getting a piece of effectively the protein coded, and your immune system learns what COVID-19 is like, and is prepared for COVID-19 by looking at this protein, so that when you do get infected, or if you get exposed to the live virus, your immune system is ready.
Thanks, Dr. Saheed. That is very reassuring to hear. Another question that we're seeing quite a bit today, for someone who knows that they already had COVID, let's say they tested positive, should they still get the COVID vaccine?
Yeah, that's a really good question. And folks may feel a little bit conflicted about that, because early on there was a discussion about a 3-month immunity period, where we know that after many patients have been exposed and had a COVID-19 infection, there's a period, and the word immunity is probably the wrong word, but there's a period where you don't get really retested and your risk of COVID infection is low. Not to say that you can't ever get COVID again, but we know that once you've been infected, there's a reduced risk of getting infected, particularly during the 3 months convalescent period. So initially the advice, as when we had a real shortage of vaccine, was that some folks who didn't who had recently gotten the infection and were in the 3-month window could potentially wait a little bit later, so that others who hadn't been exposed at all and who had no immunity could get the vaccine. Now that we're increasingly having large access to vaccination and large number of vaccine doses available for all Americans, now CDC has recalibrated that and said, if you have access to it, get vaccinated, even in the post-infectious state, because what we know is that people's infectious states are very variable. Some people have mild exposure to infection and their infection rates are low, and which correlates to unclear immunity. With the vaccine and the studies around the vaccine, we have a much more detailed understanding of the immunity profile. And so we would encourage people, even if you've gotten a COVID-19 infection, to go ahead and get vaccinated. And there's no need to pause necessarily for that. You can get vaccinated if you have access to a vaccine. Go ahead and do so.
And as a clinician, what would you counsel someone who, say, is positive for COVID right now? Is there an amount of time that they should wait before getting the vaccine?
Yeah, if they're infected with COVID right now, I think the biggest priority should be, while the vaccine is important, let's make sure that your care paradigm is being managed well, right? That your breathing is okay, that we're giving you all the latest medicines that help patients who qualify for them have reduced outcomes or reduce poor outcomes from COVID, whether that means monoclonal antibodies or convalescent plasma or steroids or whatnot. All of those options have to be discussed with your physicians. Once you're out of the infectious state, then the conversations about vaccinations can occur as to kind of how to get you vaccinated. But I do think in the acute infectious state, most clinicians working with you will focus on kind of your convalescence and getting better. And then after that, the conversations about vaccines are appropriate.
So we're now at a moment where we have 3 COVID vaccines that have emergency use authorization in the United States: the Moderna vaccine, the Pfizer vaccine, and the Johnson & Johnson, which most folks call the J&J vaccine. Can you talk us through each of them and the differences, especially between the Moderna and Pfizer mRNA vaccines and the J&J vaccine?
Right, sure. They're all, fascinating, and I guess the academic and myself really are excited about the technologies that have been unleashed to get us to the Pfizer and the Moderna vaccine. The Pfizer and Moderna are very similar in terms of the technologies that are used in developing those vaccines. Primarily, they take a small, I think I mentioned this a little earlier, but I'll expand on this a little bit. A small amount of genetic material called an mRNA that's coated with a lipid profile, lipid capsule around it that allows your body to and your cells to accommodated and fuse, and the lipid profile will fuse with your own body cell. The RNA then goes in and starts working with your cell's machinery to produce virus proteins, not the virus, just the viral protein. And the production of these viral proteins, as they spread throughout your body, allows your immune system to start to prime themselves and really prepared, because once your immune system has seen a protein, a component of something that doesn't belong in the body, it prepares itself using 2 or 3 or several different mechanisms, including the formation of antibodies against those proteins, which is really at the heart of your immunity against COVID-19 itself. That's primarily the technology behind the Pfizer and the Moderna vaccine. The Johnson & Johnson vaccine is slightly different. It uses an adenovirus capsule, and it's a little bit more based on a DNA. The Johnson & Johnson has a DNA, is based on using a DNA technology, where instead of using mRNA, which really goes into the cells and produces proteins right away, the Johnson & Johnson uses the DNA technology that fuses in with the capsule, and effectively your body will turn that into mRNA, which then produces the proteins. The advantage of the Johnson & Johnson is that DNA are much more stable as opposed to mRNA. And so, whereas both Pfizer and Moderna have to have these really Spartan requirements regarding how we maintain them, including keeping them in sub-zero freezers until they're about to be used. Johnson & Johnson is much more stable, like all DNA is, in room temperature. And so it's easier to transport, and of course it's a 1-dose vaccine as well. So the efficacy across the board from all of them vary. Initial efficacy around Moderna and Pfizer are in the upper 90s, whereas the Johnson & Johnson is around 70s. But what's important to note, even with the Johnson & Johnson, is that the protection against severe disease, hospitalization, ventilator use, and mortality, death, is pretty strong, and it approaches 99% as well. And so there are real advantages to getting any vaccine in the system, and the protective effects to the community is significant for all 3 vaccines.
Thanks, Dr. Saheed. And you just touched on this, but I want to ask you again, because we're getting several questions. Of the 3 vaccines, is one superior, and should folks hold out to get a particular vaccine?
Yeah, that's a really good question. And my answer to hold out is probably no. So getting a vaccine in a timely fashion, wherever access you can, whatever of the 3 vaccines you can get, is probably the best and safest thing right now, particularly when you consider, when you look at the national profile of how widespread COVID-19 exposure is. There's really no place where you can go where there isn't nascent COVID-19 infectious and community spread, right? So your risk of COVID-19 infection exposure is increasingly higher across many, many different communities and domains in the United States. So if you can have access to any of the 3 vaccines, you should take it. With that said, there are probably differences, and arguably some slighter than normal, in the Pfizer and Moderna approximate each other very closely. Johnson & Johnson probably slightly different, but when we focus on the outcome that matters the most, which is really, you don't want to get hospitalized for it. You don't want to be on a ventilator for it. You don't want catastrophic or any significant outcomes associated with it. All 3 vaccines are very similar in their efficacy in protecting you from these catastrophic outcomes, according to the original research in that space.
So it doesn't matter which vaccine it is, get vaccinated, and whichever one is offered to you, take that one.
Get vaccinated, because if you delay and you think you're gonna get access to another one at a later time, and in between that you get COVID, that would be an unfortunate outcome. So get vaccinated as soon as possible.
And what's your advice as a clinician for those that are fully vaccinated who want to visit with unvaccinated people?
It's really tough. CDC and good evidence guidelines suggest that if you are fully vaccinated and you're with a cohort of other fully vaccinated people, that's okay, right? Because all of you are fully vaccinated and you're allowed to now meet indoors and gather for fully vaccinated people. However, for a person who's fully vaccinated, you want to meet with somebody who's not vaccinated. Remember earlier we talked about this risk of potentially still spreading disease and being a symptomatic carrier. And so while a fully vaccinated person, the risk of a bad outcome is extraordinarily low, we still don't know fully, and we're exploring and getting more data on this. And we know that the risk of transmission is probably low, but it's not the answer of how risky, the potential for transmission still exists in people who are vaccinated to those who are unvaccinated. And if those who are kind of around who are unvaccinated are also particularly in a high risk category, one should really, really be careful. And I think that in interacting with those, you should absolutely continue to use the highest level of safety, including masks and distancing. So yeah, vaccinated patients can interact with each other per the CDC guidelines pretty safely. When you're a vaccinated patient and you're interacting with someone who's unvaccinated, there is a risk of transmission. While it's probably lower than somebody who's not vaccinated, it isn't zero, and you should be aware of that. And that's why we're still recommending that vaccinated people still take the same standard precautions in interacting with the public at large and also with people who are unvaccinated.
So get vaccinated, but continue to proceed with caution.
Absolutely, particularly for knowing that the rest of the country, the rest of the community aren't really fully vaccinated yet. We're only about a 19-20% rate as of now, and that varies wildly within different communities. So until we get to a high enough rate, get vaccinated, but continue to proceed with caution.
Thanks, Dr. Saheed. And before I move on to our next batch of questions, I want to remind those who are watching that this session is being recorded and it will be made available. And also, I want to encourage folks, if you think of questions as you're listening to this conversation, please continue to submit them. We are monitoring the chat throughout this session. So Dr. Saheed, we're seeing a lot of questions come in related to vaccines and health effects. So I'm going to ask you several questions in that area now. For those who had some type of a reaction to the first dose of Pfizer or Moderna, does that mean that they will necessarily have a reaction when they get their second dose?
No, not necessarily. There are often with the second dose, you are more likely to have perhaps a slighter, more intense and more complex set of complications. Larger numbers of people reported reactions to the second dose. However, it's not one-to-one. It depends on what your initial reaction was to the first dose. So that if the nature of your constellation was a lot of arm pain, I've talked to patients who they had a lot of arm pain with the injection on the first, but not on the second time. They felt a little bit punky in terms of fatigue and that general sense of malaise, like not having the high energy after the first, and then the second dose, they did better. I will say the second dose, there are more reports of people feeling that tired, fatigued malaise that tends to go away after a day or two, and maybe a little longer for some, a little less for others. But most people bounce right back and are back to action in short order. So getting the first and having a reaction, I would be cautious. I wouldn't schedule it when I'm going to go play a soccer game the next day, the second dose, and just give yourself a day or two to recuperate if you had a reaction to the first dose. But then after that, most patients do fine, even after having a reaction to the first and then giving the second.
So just to follow up on the points you were making, is there any reason not to get a second dose of the Pfizer or Moderna vaccines?
If you have a terrible allergic reaction possibly. And these are extraordinarily rare. And we're talking about an anaphylactic reaction that may give you pause for getting the second dose. There are medicines that we can give if somebody has had an anaphylactic reaction to the first dose of medication. That's part of why we watch you. Anyone who's gotten the virus vaccine, you'll note that there's a built-in observation period after getting the vaccine to assess for patients for anaphylactic reactions. And because there are medicines we can do administer to treat patients right away. So that can mitigate the effects of that. So that would be a real pause. But for the most part, unless there are different reasons for conversations, and we'll talk a little bit about that because some patient factors can be complicated. Most patients should be able to, even if they have reactions, to get the second dose without any major complications. And the reactions will stay in the same vein of myalgias, which are muscle aches, fatigue, maybe low-grade temperatures, and then again, several days after, most people recuperate quite quickly and return back to activities, their normal activities shortly thereafter.
And do you have any tips for folks as they prepare to get vaccinated? So, for example, I've heard that you should drink a lot of water, make sure you get a good night's sleep the night before, anything like that?
I think that's just good general life advice for everything. So, I remember when I scheduled my vaccination, which was quite minimally, not very early. I had to work the next day and just kind of push through. And I actually was fortunate enough to not have major side effects, even though I mentally anticipated it. But no, I don't know any good advice beyond that. That's good life advice in general. And so I encourage everyone to drink lots of water and get as much sleep as they possibly can.
COVID vaccines and life advice. It's a good session. Okay, we're seeing several questions come in about particular health concerns relative to the vaccine, and we won't have time to cover all of them. So I'm going to batch them and ask you about the most common ones that I'm seeing come in today. What do we know about Guillain-Barré and the COVID vaccine?
Yeah, Guillain-Barré is a very rare condition where you have muscular paralysis syndrome secondary to a post-viral illness. It is a very rare condition. I think we see 5,000, 6,000 patients a year in the entire country who have Guillain-Barré syndrome, not related to the vaccine. I'm just talking about Guillain-Barré syndrome in general. So GBS is a rare condition in general. Historically, the vast majority of people who develop GBS are related to having a viral infection. Multiple different type of viral infections can predispose you to this serious complication. With COVID-19, and I think I looked at the CDC and the data websites around this maybe about 2 weeks ago to confirm. Obviously, the reports are ongoing and require continued monitoring, but there have been no clear cases associated of GBS related to the COVID-19 virus. And we've given 60 million, well, we've given more than that. We've given 150 million plus doses, and 65 million people have been vaccinated. And so there, as of now, based on the data that the CDC and research is putting out there, there does not seem to be any evidence of a relationship between GBS and the COVID-19 vaccine, so which is good news. There have been case reports about COVID-19 itself causing GBS, so there's some of that around, and we may see data evolve in this, but ultimately, it is such a rare complication. I worry about kind of the prism of risk, right? So like for me, this is something that's so rare, but what's not so rare is what I've seen is the impact of COVID-19 and the sequelae or the bad outcome related to people who develop COVID-19. And so on balance, I think, I'm not dismissing anyone's fears about this complication, but the rarity of it makes it on scale much less of a priority in my mind as compared to what could happen if you don't get the vaccine and you get COVID-19.
Thanks, Dr. Saeed. And I suspect we may have a similar conversation with this next question, which is, can you talk about Bell's palsy and the COVID vaccines?
That's a similar conversation. There are post-viral syndromes that have been associated with Bell's palsy. Bell's palsy is a bit more frequent, but in terms of the population and in terms of the incidence of it. But ultimately, on looking at, and there have been some patient classifications of Bell's palsy in the reports associated with particularly two of the vaccine. But when you looked at it, the incidence was the same, not only in those who received the vaccine, but on those who didn't receive the vaccine. And so the analysis, it looks like it's just a nascent or population incidence that was picked up, not necessarily related to the vaccine, because there is a population incidence of people developing Bell's palsy. So there is no association as of now that can be tied to suggest that it's reasonable to suggest that COVID-19 has resulted in Bell's palsy or causes Bell's palsy. The rates of Bell's palsy have been the same, and the community rates as well. So I would not, I do not think, as of now, as the data we have now, think that Bell's palsy is being caused by the vaccine.
Thanks, Dr. Saeed. Again, very reassuring to hear. Another question about health effects. So the Pfizer and Moderna vaccines, as you've mentioned, use this new mRNA technology, which is very exciting, but also understandably leads folks to have a lot of questions. And one is there any reason to be concerned that the mRNA vaccines increase the risk for cancer?
No, there's no evidence to suggest that there's an increased risk of cancer associated with the mRNA vaccine. We have really some good data with early coronavirus work in this space, and certainly we're increasingly having good data across the board. The mRNA vaccine don't get incorporated, particularly mRNA, into your DNA at all, and so they produce proteins in the outside of the nucleus of the cell, and there's no suggestion or evidence or data correlating the mRNA vaccines to cancer at all. We'll continue to monitor it. You know, what's fantastic is that the CDC has a virus kind of adverse event monitoring system where if there are concerns by clinicians across the country that there's an adverse effect to their patient is related to a virus, it's submitted. And so there's kind of a nascent level of detection and monitoring, not only for these vaccines, but across the board for all vaccines. And there's no data as of now to suggest that at all.
Thanks, Dr. Saeed. Again, very reassuring to hear your answer to that question. So I'm also seeing a lot of questions come in related to immunity and the COVID vaccines. So I'm now going to switch over to that topic. And the first question is, what do we know so far about how long immunity lasts once someone is fully vaccinated against COVID?
Yeah, this is complicated, and there's some immune response studies that don't necessarily capture the full picture because they're only looking at the antibodies within the bloodstream that suggest that, and showed evidence that your antibody production lasts 3-6 months post the vaccine, which is great. And some data, more recent data, particularly pushed out by Pfizer, Moderna put out a letter at the New England Journal of Medicine, highlighting their data in this space as well, suggesting maybe even longer than that, 6-9 months. So I would say conservatively, we're being very conservative in suggesting that maybe 6 months, maybe more, but we think likely much longer than that. Some would suggest 8 months, 9 months, much longer than that. Clearly, as more and more people get vaccinated, we will see the trends, and this is data that is being collected and watched and observed over time. But in the meantime, I think conservatively we can say 6 to 8 months to 9 months is probably a good place where you have very strong immunity. Now, when people say that the immunity changes, we're not sure, but there's a concern that it may slowly start to wane after that. And that we need more evidence and more data around to figure out how much it wanes, what's the nature of the degradation of the protection, and more science is being worked on in that space to very clearly elucidate that better.
And the answer that you just gave about what we know in terms of duration of immunity, does that vary among the three vaccines that have the EUA right now, or is it the answer pretty much the same across all three?
It varies slightly. There's some potential. We know a little bit. The evidence around the Johnson & Johnson perhaps suggests a little bit of less of antibody initially, but in terms of the long-term serious adverse effects, that seems to compare across all three. And so my sense is that I think all three have pretty similar profiles, but not to we will know more about whether or not the performance of the Pfizer Moderna confer even longer versus the Johnson & Johnson, which may confer even longer immunity. I can't answer that definitively, but they seem pretty similar now based on the current data that we have.
Thanks, Dr. Saeed. And one more question along these lines. So given what we know so far about the vaccines and immunity, do you think it's likely that we'll be in a position where folks need to get a booster shot somewhere down the road, or meaning another round of vaccination to ensure longer term protection?
Yeah.
Where do you feel like we are on that?
Yeah, no, that's an interesting question, and it's hard to answer that right now. I can't say that that's an impossibility. It would be fantastic if we could get not only huge numbers of people in the United States vaccinated in a time space that's quick and rapid, as has been laid out by the White House task force on this, and really get everyone vaccinated. Because what happens is the more and more we move towards herd immunity, the more and more you reduce the reservoirs of COVID-19 in the community and the risk of infection. And that even as our immunity wanes, as long as there's not COVID circling in the community, one could then use targeted booster approach as opposed to widespread booster approach. So, is it possible we'll have to do a booster? Sure. But if we can all get vaccinated and really adhere as much as possible to our goal of a national vaccination cycle where all of us, to the tune of 80–90% of our population get vaccinated in rapid order, that would reduce the risk of infection in the acute phase and maybe possibly even reduce the risk of potentially needing boosters, et cetera, across the board.
Thanks, Dr. Saeed. And I'm going to pause here to again remind our audience that this session is being recorded and it will be available afterwards. And I am continuing to keep my eye on the chat. So if you think of additional questions during the remainder of the session, please submit them and we'll try to get to as many as we can. So Dr. Saeed, I'm seeing a lot of questions come in that I'll say fall into the general area of reproductive or fertility concerns, and I'm gonna turn now to those questions. The first one is, can you talk us through generally what do we know about the COVID vaccines and pregnant women or mothers that are nursing young children?
Yeah, there's very little. When we do big research studies, one of the areas that's really tough is it's hard to reasonably, particularly in first stage research studies on medications and new technologies or drugs or even vaccines, get pregnant women to be enrolled as part of the first pass. And so we do have a paucity, very little data on pregnancy and the vaccine. With that said, I will say the fact that it's not a live virus is reassuring, and there are expert consensus panel. And in light of the fact that the possibility of getting COVID-19 from the vaccine is zero, who really advocate, particularly because there is some data in pregnant women of worsened observational data that suggests worsened outcomes for pregnancy if you do have COVID-19, worsened maternal outcomes, and perhaps some data suggests worsened fetal outcomes as well. There are many physicians who strongly advocate for pregnant women to get vaccinated because of the alternative risk of a COVID-19 infection in pregnancy. This is probably a conversation based on that's best had with you and your OBGYN, considering the risk factors for each particular pregnancy and fetus and what's going on with the patient's particular risk factors. But there's really strong evidence to suggest that pregnant women, it's not evidence, strong consensus expert and clinical reason to suggest that there's value for pregnant women, particularly if there's a real risk of COVID-19 infection being significant and catastrophic in that cohort, to get vaccinated.
Thanks, Dr. Saheed. Similar question, but for mothers who are currently nursing.
Yeah, I came across my desk maybe about several days ago, new data that looked at vaccinated women and saw that there were antibodies that were crossing into protective antibodies for COVID-19 in the breast milk, and which is really, really outstanding and suggests some protection for the newborn baby as a result of lactating mothers being vaccinated. There's, again, no good studies that target lactating mothers or pregnant women in this space. But what we know about the way the vaccine works is again, you do not get COVID-19 from the vaccine because you're not getting live virus. And so if your body develops an immunity to it, we know that part of what makes breast milk so powerful for children is as you develop immunity, you often transmit through the form of antibodies in your breast milk to your children that are ingesting the breast milk. So yes, it seems like that not only is vaccination safe for lactating women, but maybe even desired in terms of it confers protection to the baby as well. This is a conversation to be had with your doctor, talking about risk factors, but I would say the lactation evidence is probably on a perhaps even stronger sounding because the baby's born now and it's really about you providing antibodies to the fetus, to the baby, which is good.
That's exciting news. So another question in this general area of reproductive concerns is, what about those who are thinking of getting pregnant, especially if they're thinking of getting pregnant soon? Any reason to not get the COVID vaccine?
Yeah, there's no evidence that I've seen that suggests that the vaccination impacts fertility or at all. There were some very early observational studies that looked at COVID-19 and saw maybe in men reduction in sperm quality or quantity or the high quality sperm. Some data around that. But in terms of the vaccine causing outcomes, negative outcomes as relates to fertility, there's no evidence to suggest that at all. I talked about the sperm quality to balance that, to suggest that we do maybe see some trends to evidence or data that may suggest that COVID itself can impact fertility. But we've not seen evidence that the vaccine against COVID would do the same or does anything similar. So in my mind, I would say, knowing that the evidence is still pretty poor in this area, but that the vaccine may be protective if there is any data that COVID-19 infection does cause fertility issues, particularly in male, having the vaccine to prevent you from getting the full infection probably is more protective than others. But that's an area of active monitoring. But as of now, there's no evidence to suggest that the COVID-19 vaccine causes any fertility issues.
Again, very, very reassuring. Thank you, Dr. Saheed. I see we have a lot of questions coming in related to children and the COVID vaccine. So I'm going to switch to that topic now. And my first question to you is just generally, where are we with children, meaning, and I guess children can mean those under 18, those under 16, and COVID vaccination?
Yeah, Pfizer, the studies were 16 and above, Moderna was 18 and above, and so was Johnson and Johnson. So maybe Pfizer has that kind of 2-year window where 16 and above can receive the Pfizer vaccine. There are active recruitment, literally for children down to babies for these vaccines. I know that because I've seen them posted, and my wife and I discussed enrolling our kids in it and to see if we can get a heads up on the vaccine game for the children. I think that probably the evidence is going to be pretty strong in support of this. But yes, it's an area of active research. There isn't, based on the EUA, which is the FDA's use authorization for the 3 vaccine, any approved vaccine for the pediatric population, but it's an area of active research.
And thanks. Like I said, I know this is an area that a lot of folks care about because I'm seeing how many questions are coming in. As a clinician, what's your advice to those who have young children who, of course, are not vaccinated because that's not possible right now? What do you recommend in terms of having those children around others who are vaccinated or not vaccinated? What's the best way to think through these complicated decisions?
Yeah, these are complicated decisions. I think ultimately you protect young children by having all the adults and people who are potentially in high risk categories vaccinated. Children are children. And the good news throughout this pandemic is that children, for the most part, less than 1%, never say never. There are some kids who've had very bad outcomes related to COVID-19. And we've certainly seen lots of reports and cases associated with that. However, for the vast majority of children, the COVID-19 infection for them is not the mortality, morbidity, bad outcomes associated to that is all much lower. And so children seem to pass through these infections, even across all the countries that have been studied, Italy, China, South Korea, and the United States. The infections have been much more benign in the pediatric population. However, huge caveats, they can spread it, they can give it to folks. And so this is why it's so important for our adult populations, because we're the only ones that can get vaccinated now, to get vaccinated, because it really does reduce the risk of exposure from an inadvertent infection from a pediatric, your grandkids coming over to visit. Well, if grandparents are both vaccinated, that allows that visit to occur, and the grandparents can feel pretty safe.
And is it typical in the development of a vaccine that we first learn about the adult population and then it's later focuses on children?
Yeah, that's a really good question and absolutely typical, not only in terms of vaccine, but much of medicine. You want to say unfortunately, but the nature of research is that if you're starting something quote unquote experimental, we don't often put our most vulnerable populations to the front of the line. So our pregnant patients, our children are not usually at the front of the line. We start with healthy adults. And then as that kind of, we understand the safety profile and feel pretty confident about the safety profile, then the research marches forward. Now, obviously, if it's a disease that affects children in particular, you may see a different approach to it. But most of the time, we really do try to be conscious about the vulnerability of certain populations. And so that's really why there's been a delay in kind of enrolling children. I will say the parameters of COVID-19 in terms of its clinical acuity being much less than the pediatric population, probably also as part of that decision, is that we know that kids weren't as affected as adults by this virus. But of course, they can be reservoirs in terms of they can get infected from it and they can spread it to others. So I think we're now to the stage where if we're trying to manage the COVID risk across the entire population, we need to think not only about adults, but about everybody else who potentially can have COVID and spread it. And so we're at an appropriate point thinking about pediatrics, but it was appropriate not to start off with that vulnerable population.
And I'm going to merge this conversation with our previous one about fertility, because I see several questions about this coming in. What do you say to folks that are concerned about getting their children or adolescents vaccinated because of fertility concerns related to the COVID vaccine, meaning down the road?
Down the road. Again, I have to reaffirm that there's no evidence of vaccine-related fertility issues for anybody. And so this is really important to point out. And based on the evidence that suggests that COVID-19 infections may affect fertility, I'm more concerned about that as opposed to the vaccine being the cause, because there's no evidence to suggest that the vaccine causes any fertility-related complications.
Got it. Thank you. And in our last few minutes together, I want to talk a bit about, and we have many questions about this, those who are hesitant to get vaccinated or are skeptical about the COVID vaccine. And there's a whole host of reasons why individuals may feel this way. But the questions that I'm seeing coming in relate to long-term effects of the vaccine. And so how do you talk to someone about that and provide reassurance?
Yeah, no, that's a really good point. It's interesting overall. I think for me, the way I balance it is this is a balancing of overall risk. So what we've seen is that there are in patients, I'm going to answer this slightly circuitously, there are in patients with COVID-19 who have long-term effects. I had a friend who was infected with COVID, and he called me the other day and we were talking, and he commented on how his sense of smell never really returned appropriately, and that he's lost enjoyment of one of his favorite foods because it tastes like dust and smells really funny to him. And that's persisted. And this is maybe now 8 months after he was originally infected with COVID. And I bring that up to talk about the fact that COVID-19 has increasingly well established these chronic side effects that don't rise the level of morbidity or mortality, but are plaguing a huge portion of people who've been infected with COVID. And from the COVID-19 vaccine profile, there is, again, very limited evidence to suggest poor or bad outcomes. And it's been very, very protective and very well studied in hundreds of thousands of patients, now millions of people getting it. And we're watching to see side effects and impact. And we're seeing very, very minimal negative impact from these vaccines. It's perhaps person one was a bit of an adventurer. 61 million, it's like you're not that much of an adventurer now, and one shouldn't think about it as this wildly dangerous thing. We've got 61 million plus people have been vaccinated. We have tremendous data on the profile of this, and it's increasingly validated as very safe. And then when you contrast it with what we know about what could happen when you get COVID-19, it seems to me, I don't want to say no-brainer, but I strongly encourage people to do it. I've had this personal conversation with my family member. I had to really talk a lot with my mother, who happens to be a nurse, and she knows better, but she was very worried. It was quick. It was a previous administration. I don't know if people cut corners, all the same things. And we talked long and hard about it. But increasingly, as she's seen the impact of COVID, and also seeing that so many people have gotten it, myself included, and we didn't grow that third horn and everybody is fine, she became much more comfortable with it. And I'm pleased to say last Wednesday got her first shot. So so I think that there's really good evidence now, 60 million plus people, and actually much more than that when you think about the international community's vaccination evidence that we have. It's tremendous how many people have been vaccinated, and I think one should take comfort in that, because we are tracking and monitoring the impact of the vaccination on patients, and it's still proven safe.
Thanks, Dr. Saheed. I think that's a great note to end on. It's hard to believe, but we've been talking about this for an hour or so. So I'd like to thank Dr. Mustapha Saheed for joining me today, and also give a big thank you to everyone who joined us, and especially to those who submitted questions for Dr. Saheed to answer. This town hall, which is part of the Get the Facts About the Vax campaign, will be archived and available for viewing. I hope you've enjoyed this session, and remember, as we discussed, the COVID vaccine helps us to protect ourselves and also our communities. Thank you, and stay safe.